Hello, and welcome to the Whip-Mix Corporation educational video utilizing the dental articulator and its associated components. My name is Dr. Robert Faulkner. The main purposes of use of the dental articulator are to relate the mandibular cast to the maxillary cast in as accurate a way possible, and to evaluate the mandibular movements of the patient. Articulators and their use are taught in virtually all dental schools. Yet, once the dentist begins private practice, use of the articulator is seldom employed. There are many reasons for this, but the most common is the perceived difficulty in utilizing the instrument. Today's dental articulators are not only easier to use, but they provide a high degree of accuracy. This allows the discerning practitioner to perform an occlusal analysis, evaluate parafunctional activities of the patient, aids in diagnosis and treatment planning, and allows for more accurate dental restorations. In addition, it provides an excellent means of communication with their patients. Along with my assistant Holly, I will be demonstrating the use of the Whip-Mix 2240Q articulator, making maxillary and mandibular impressions, recording a FACEBO record, obtaining a centric relation interocclusal record, and proper mounting of the patient cast will be illustrated. We will also demonstrate the basic procedures for setting the articulator prior to mounting the patient cast. This video is divided into several chapters for quick review of each step. We hope that you enjoy its contents, and we wish you much success with the use of your articulator in the future. Good morning, Lauren.
Good morning.
How are you this morning?
Good, how are you?
Good. I want to first explain to you what we're going to be doing this morning. We're going to be making some diagnostic records here today that will allow us to further analyze your information so that when we sit down and we talk about whatever treatment might be necessary, we'll have a way in which to look at how your teeth actually function. We're going to start by making impressions of your teeth here this morning. Once we make those impressions, then we're going to make two other jaw measurements here. We're going to make one called a FACEBO. That's something that actually relates your upper jaw to your skull. And then we're going to make two bite records, very specific bite records to allow us to put things together on an instrument called an articulator. That's something that allows me to study how your jaw functions without you actually being here. Okay, you ready to get started?
Yep.
Okay. What I'd like for you to do is please just tip your... We must first check the tray's fit in the mouth. Starting with the lower tray, rotate the tray into the mouth, then have the patient raise their tongue prior to seating of the impression tray. Be sure there is no impingement on the soft tissue. Open for me, please. This procedure is then repeated by sizing the maxillary impression tray. Once again, make sure that there is no impingement upon the tissues. The procedure for mixing the irreversible hydrocolloid, the alginate, is to mix it according to manufacturer's recommendations. The water is first placed in the bowl and then the powder added to it, and it is mixed until a homogeneous consistency is obtained. The tray is then loaded, being careful not to overload the tray. Load just to the top of the impression tray. First, place a small amount of impression material on your finger and rub well into the anatomy of the tooth surface. Rotate the filled impression tray onto the lower arch, then have the patient raise their tongue. Press the tray firmly on the teeth, taking care to register the impression accurately. Next, mold the facial tissue around the impression tray to help record the anatomical detail of the mouth.
Once the impression material is fully set, the impression tray is removed from the mouth.
Lauren, we're going to begin the next portion by making the FACEBO record. This is the part that I mentioned to you earlier, that we're going to relate your upper jaw to your skull and to this joint that's up by your ear here. So we're going to go ahead and get started with that. You all set?
Yep.
Okay.
To prepare the bite fork for the FACEBO, we first adapt impression compound by softening in a hot water bath at 140 degrees. Once the material has reached a dead soft consistency, it can then be adapted to the bite fork. The impression compound is applied to both surfaces so that all the metal is covered. This will allow us to place the bite fork in the patient's mouth without burning the soft tissues. Place the bite fork into the mouth. Position the fork so that the stem of the fork aligns with the facial midline, and support the fork until the material is set. The best way to check the alignment of the bite fork is to view the patient from behind. Note how the stem of the fork is aligned perpendicular with the facial plane. When the material is set, gently remove the fork. Rinse the impression compound under cold water. Inspect the registration for any soft tissue or deep occlusal registrations. Any excess can be trimmed away with a barred Parker blade. Place the bite fork back into the mouth. Ensure the cusp tips seat all the way into the registration record. Support the bite fork underneath by having the patient bite on cotton rolls. Occasionally, the bite fork may need to be supported by the assistant during the recording of the FACEBO registration. With the patient keeping very still, raise the chair up to a seated position.
All right, the way this is going to work, I want you to keep your head right in the headrest. I'm going to slip this on the piece right here and tighten it. But before I do that, I'm going to have you take these, place these in your ears, and put one finger on either side, just like this for me. So why don't you go ahead and brush your hair back behind your ears there for us. Go ahead and place those in your ears. Rotate this around right in place here. Make sure you're staying closed all the way on the cotton. Okay. Now this next piece is going to rest right against your nose. Actually, the bridge of your nose. You're going to feel a little pressure here. When you feel some pressure, I want you to push in lightly at your ears for me. Tighten this. Now you can take your hands away, turn your head just gently towards me right there. That's fine. You can put your hands down now. That's fine. With your eyes, I want you to look straight at the tip of my nose and just kind of stare right there at that point.
Once the FACEBO is in place, gently tighten the toggle, taking care not to tilt the FACEBO. Next, have the patient gently hold the FACEBO arms to stabilize it as you finish tightening the toggle. Here we have the completed FACEBO transfer. Note that the FACEBO is centered on the patient's face and the transverse bar is parallel with the interpupillary line.
Just hold on to the side of it.
While the patient stabilizes the FACEBO, begin loosening the knob that was used to tighten the nasion. Next, loosen the center thumb screw on top of the facebow. The entire facebow assembly is removed by advising the patient to pull the earpieces out of the ears while helping to remove the bite fork from the mouth. This same procedure can also be performed with a more traditional transfer assembly. While there are a few subtle differences, many of the following steps illustrated will remain the same. The bite fork is prepared with the impression compound as was previously described. Place the bite fork into the mouth. Position the fork so that the stem of the fork aligns with the facial midline and support the fork until the material is set. The best way to check the alignment of the bite fork is to view the patient from behind. Note how the stem of the fork is aligned perpendicular with the facial plane. When the material is set, gently remove the fork. Rinse the impression compound under cold water. Inspect the registration for any soft tissue or deep occlusal registrations. Any excess can be trimmed away with a barred Parker blade. The final bite fork with impression compound should have only cusped tips and incisal edges registered and no perforations through to the metal. Place the bite fork back into the mouth. Ensure the cusp tips seat all the way into the registration record. Support the bite fork underneath by having the patient bite on cotton rolls. Occasionally, the bite fork may need to be supported by the assistant during the recording of the facebow registration. Raise the chair up to a seated position.
What I'm going to do is I'm going to slide this on the little post that's coming out of your mouth. Once I do that, I want you to reach up, take these and place these in your ears. And I want you to put one finger on either side, just like that, and just hold gently against that. Keep your head in the headrest at all times, please. Okay, go ahead and place those up in your ears. Great, just one finger, that's super. Okay, just a little lighter there with your pressure. You don't want very much pressure. And let's move your hand back here towards your ear a little bit closer. Good. All right, this piece is going to fit right against the bridge of your nose. Make sure you keep your teeth closed against that cotton at all times for me. When you feel a little pressure here, I want you to push in at your ears just slightly. Okay, hold on to it there just like that.
Once the facebow is in place, gently tighten the toggle, taking care not to tilt the facebow. Next, have the patient gently hold the facebow arms to stabilize it as you finish tightening the toggle. Here we have the completed facebow transfer. Note that the facebow is centered on the patient's face and the transverse bar is parallel with the interpupillary line. While the patient stabilizes the facebow, carefully slide the nosepiece away from the patient's nose, loosen the center thumb screw on top of the facebow. The entire facebow assembly is removed by advising the patient to pull the earpieces out of the ears while helping to remove the bite fork from the mouth. All right, we're going to prepare the interocclusal recording material. What we use for this particular step is Beauty Pink Extra Hard Wax made by Moico. This is tempered in a hot water bath preset at 140 degrees. We first soften the wax, then fold it on its end, and then cut it to the approximate size of the dental arch. We want to cut it in somewhat of the shape of the arch as well, and we will also allow room for
the leaf gauge or any anterior deprogrammer to be able to be used in this step. Again, the anterior area is relieved. Once it is cut, it's positioned in this manner. This will allow a positioning of the interocclusal record deprogramming device to be able to be used, as you see the leaf gauge in place here. Again, this can also be used with an anterior deprogrammer.
To help the patient achieve a centric relation position, use an anterior deprogramming device such as a leaf gauge. Place the leaf gauge between the maxillary mandibular incisors. Instruct the patient to protrude and then retrude the mandible while closing on the leaf gauge. The retrusion should be until the mandible stops on its own. Do not force the mandible back. Additional leaves are required if posterior contacts are present. Ideal disclusion is 0.5 millimeters in the posterior region. This cycle should be repeated to verify that posterior disclusion is maintained. What we're going to do next, I'm going to soften this wax. It's a very specific type of wax. And I'm going to get it nice and soft in a hot water bath. Remove the leaf gauge and place the softened wax into the mouth. Next, place the leaf gauge between the teeth and through the pre-cut slot. Instruct the patient to close on the registration wax and then protrude and retrude, then squeeze lightly together. To ensure the material is set, chill the wax with air. Continue to hold together. Now just barely open, close, barely open, close, open all the way now. Stay open there for us. Relax. Open for me. And your back teeth, close, squeeze. Slide your jaw forward slightly and back. Hold right there. Okay, we're going to check, make sure your jaw's in the right position again here. Hold right together with that. You feel a little pressure. You shouldn't feel any pain. All right, now we're going to chill the wax here with a little bit of air. Okay, Lauren, I want to check to see where your first tooth is touching here. There's going to be a tooth touch somewhere in your mouth first before the others with your jaw joint hinged like this. So what I'm going to do is take away a few of the leaves on the leaf gauge here until we find that first point of contact. Okay? Okay. Now, I need for you to open here for me slightly, a little bit more. I want you to stay open like that. Don't let anything close. Let's decrease it down to about 10 leaves here. Okay, now close for me again. Slide forward and back. Feel any teeth contacting there at all? No. Okay, open here for me. Stay open just like that. Okay, close. Slide forward and back. Feel any teeth contacting now?
All right, back.
Back here on this back right side?
Yes.
Okay, good. Let's check that. Okay, Holly, if you'll take the leaf gauge there. Open for me a little bit here. Pull your tongue back a little bit. Close for me. Slide forward and back. Okay, that's the contact that we were looking for. Okay, open for me here. Take the cheek retractor out here. Go ahead and put the leaf gauge in for us, please. Close, slide forward and back. Okay, I'm going to have you just barely open. You should feel that tooth touch in just a second. Open slightly for me. Feel that tooth touching?
Mm-hmm.
Just hold right there. Open just slightly. Just let your jaw relax now. And just close to your first touch. Feel it touching right there. Hold there. And close on down. Okay, so you have a little bit of a slide there. All right, relax your jaw. An alternative to the leaf gauge is a Lucia jig. Dry the central incisors before placing the Lucia jig. Then have the patient close with their mandibular anterior teeth gently against the underneath side of the Lucia jig. Check to make sure that no posterior teeth are touching. Once neuromuscular relaxation has occurred, we will allow the patient to protrude and then retrude the mandible against the Lucia jig. We need to ensure that the patient has free movement without any posterior interferences and without any muscle interference, allowing free movement of the mandible. We then check to make sure that the condyles are fully seated before making the centric relation record. With the Lucia jig in place, seat the wax record into the mouth. Have the patient bring their teeth together until cuss tips contact the wax record. Have the patient slowly slide their teeth forward and back. Once the registration is made, chill the wax record before removing. When we prepare the wax for the protrusive record, we do it very much in the same manner that we prepared the wax for the interocclusal centric relation record. We again soften the Beauty Pink extra hard wax in the hot water bath at 140 degrees. We double it again, and we cut it much in the same manner according to the size of the dental arch that we will be recording. This time, however, we will be leaving the anterior region intact so that we can use that as a guide to be able to see the anterior teeth come end to end in the protrusive manner. Again, when we get ready to use this, we'll soften this wax to a uniform consistency, a dead soft consistency in the hot water bath. Again, knead the material as was described earlier when using the wax for the interocclusal record. And once it reaches its consistency, we're ready to go to the mouth to record the protrusive record. Once the wax has been softened, place the wax record into the mouth. Instruct the patient to close their mouth, then move their teeth forward to record the protrusive record. Be sure to allow the wax record to completely cool before removing. We're going to get ready to mount the casts that have been generated from the diagnostic impressions that were made previously. 2 stone casts have been poured and trimmed. We'll use those later, but in getting the articulator ready, we need to make sure that there are certain settings that are in the correct position prior to mounting the maxillary cast to the face bow. The first setting that we are going to check is the condylar setting. That should be in the FB position as indicated on the right condyle element on the articulator. Both the right and left condyle settings should be set prior to mounting at the face bow position. The second part of the articulator that needs to be checked is to make sure that the side shift guides are set to the 0 position. Aligning the long line on the removable piece of the side shift with the tallest line on the stationary mount allows us to position that side shift to the 0 degree point. The third part of the articulator that needs to be set is the centric lock. During the mounting of the maxillary cast and the mandibular cast in centric relation, the centric lock mechanism should be in the locked position. The articulator is now ready for mounting the face bow. Raise or remove the incisal guide pin so that it won't interfere with the upper member being placed on the crossbar of the face bow during the mounting procedure. Next, place the metal disc into the slot on the plastic mounting plate and attach the plate to the upper member. We can now attach the face bow to the articulator by means of the brass face bow mounting pins located along the side of the condylar element, making sure that the earpieces are pushed up against the side of the condylar element. Tighten the anterior face bow thumb screw and check to make sure that the side thumb screws are secure as well. Check to make sure that the upper member of the articulator will close down on the crossbar without any interferences. If you haven't done so already, slide the Nasion relator assembly out of the way. Many clinicians prefer to use a face bow fork support when mounting the maxillary cast to support the face bow fork during the mounting procedure. This is an optional piece, and as is demonstrated here, it is secured by means of the magnet. Next, the maxillary cast is positioned and is now ready for mounting. One additional note, the relationship of the maxillary cast to the maxillary member of the articulator with the face bow in place will not change during the mounting regardless of the angle, because this has been preset so that the axis orbital plane can be maintained through the entire mounting process of the maxillary cast. After the mounting stone on the maxillary cast has set, we can then proceed with mounting the mandibular cast. Invert the articulator. The articulator will be supported by the black knobs on top and the incisal guide pin. Open the articulator and place a mounting plate on the lower member of the articulator as shown. Inspect both maxillary and mandibular casts for nodules or other interferences. If interferences are present, remove them, being careful not to change the occlusal relationship. Next, place the interocclusal record on the maxillary cast. Carefully position the mandibular cast on the wax interocclusal record. There should be a very positive seat between the cast and the wax interocclusal record. If in fact there is any distortion or rocking motion, the interocclusal record should be considered inaccurate and remade. Check to make sure you have enough clearance between the base of the mandibular cast and the lower mounting surface of the articulator. If necessary, remove enough of the base of the mandibular cast to have room for the mounting stone. It is recommended that you place a gypsum separating medium on the base of the cast, usually in the indexed area. This will facilitate the easy separation of the cast if needed. As demonstrated here, we're using Vaseline as our separating medium. Mount the mandibular cast in the same fashion as the maxillary cast was mounted. When closing the mandibular member, again verify that there is full seat in the condylar elements and that the end of the incisal guide pin touching the plastic incisal guide table. Allow the mounting stone to set. It is not necessary to overfill the area on top of the cast with stone, as this will be added to at a later time once the mounting has been verified. Once the mounting stone has set, you can verify the accuracy of the mounting by using articulating paper and locating the same first contact on the cast as was identified by the patient. At this point, we need to evaluate for any slides or occlusal discrepancies. To do this, loosen the incisal guide pin screw, raise the pin, and temporarily retighten the screw. Unlock the centric latch, close the articulator to the first point of contact, making sure that the condylar elements are seated, and then close to the maximum intercuspal position. Watch for any sliding movement. The same slide that was produced in the patient clinically should be reproduced on the articulator if present. To set the protrusive guidance, remove the incisal guide pin and carefully place the protrusive record on the cast. Unlock the centric latch and carefully rotate the maxillary cast into the protrusive record. Carefully invert the articulator. Loosen both condylar guide elements by loosening the black clamp screw knobs. When loosening the clamp knobs, ensure that you keep them snug so that rotation of the condylar element is accomplished without losing the ability to control the rotation. Place the articulator upside down. Make sure that the protrusive record is fully seated, then check for space between the superior wall and the condylar element. If space is present, carefully rotate the condylar guide element up until it touches the condylar ball. It is recommended that you do this by both tactile and visual observation. Tighten the clamp knob on that side. Perform the same procedure on the opposite side and then tighten the clamp knob screw on that side as well. The use of the dental articulator truly can enhance your practice. From patient education and case acceptance to analyzing the occlusal scheme and constructing more predictable dental restorations, the articulator provides a valuable adjunct to your clinical practice. If you have further technical questions regarding the use of the Whip-Mix articulator, you can visit their website at www.whipmix.com, or you can contact them at their toll-free number 800-626-5651.